Welcome to today's People to People. I'm Brett Vickery in for Micah Mater. We're getting things started this morning with some of the medical headlines impacting communities here in Chicago. Here to cover it all is our medical dream team, Dr. Ngozi Ezike, President and CEO of Sinai Chicago. I hope I said your name right. Beautiful name there. And Dr. Jeffrey Sterling, author and President, CEO of Sterling Initiatives. Good morning. Thanks for being with us.
Good morning. Always good to be with you.
Well, there's a lot going on, medical community. We have a lot to get to. Want to start, though, with Dr. Sterling. We're talking about preventative care. We're just getting back to basics. Kind of talk to me about that.
Absolutely. You know, it's really very simple. An ounce of prevention will always be worth a pound of cure. And the way things have been going lately, we just want people to be in touch with the fact that they are the best stewards of their own health care. People have to take steps to become empowered, to know when to seek care, how to take care of themselves to prevent illness, and when to present to places like an emergency department or the doctor's offices.
Yeah, and when it comes to, battling misinformation, kind of navigating, there's poor access, maybe financial limitations, maybe what do you have, words of encouragement do you have maybe for anyone battling with that?
Rule number one is always consider the source. There's so many would-be cures for cancer these days. If there really was that thing, it wouldn't be coming from the types of sources that people tend to grab the information and send it over to me via social media. Get yourself a trusted provider, a trusted messenger, and verify that information. When you actually engage, learn how to get questions so that you can be empowered in the conversation. Don't just sit there and expect to be told this, that, or the other. Act on yourself, act on the situation, and you actually will do better.
Yeah, and sometimes there are people, especially in our community, I might be like, I'm fine sticking through these symptoms. I don't want to be seen as maybe a hypochondriac or like I'm fine. At what point do people need to power through or go see a doctor and go trust a doctor rather than just kind of dealing with symptoms?
It really disappoints. Again, I'm an emergency physician, so it really disappoints me when people come in too late.
Yeah.
I tell people all the time, it's my job not to judge, but to treat. It's okay. If I don't give everybody good news, so if you come and everything works out okay, that's the best possible thing that can happen. Please learn to engage the system at the earliest opportunity, and it's okay if everything checks out. Learn to get engaged. Don't wait, because time is tissue, as we say in emergency medicine. If you wait too long, then the chance of you actually getting the help you need is dramatically lessened.
And you can give them good news when you tell them you came on time. You came before it was too late. That is good news in whatever kind of situation, as much as you can be in a tough situation. Dr. Ezike, we're seeing Colon Cancer Awareness Month is here. You've set the example for some of your staff members. Kind of talk to me about that and the importance of even beyond March addressing that.
That's right. So March, we're at the end of March, but this is Colorectal Cancer Awareness Month. And so it's a big thing because cancer is the #2 cause of deaths for Americans throughout the country, men and women, and we are seeing it come in younger people, And so I think a lot of people might not know that the newest guidelines, which are a couple years old, say that you're supposed to start the screening at 45 and not 50. And so, the campaign that the American Cancer Society has out there is your colon is 45. So anyone who's 45 should really look to get that colonoscopy because, again, just following up on Dr. Sterling's comments, if you find it early, that's the best thing. Early detection can lead to, great outcomes. And that's what we want for everyone. We don't want to find out that you presented too late or you're going to need all this extensive care. So early detection, I just had my colonoscopy this month in celebration of the month, and I'm encouraging others to do the same. The colonoscopy is a painless procedure, and so we've got to get more people doing it. And we also do see that it is more prevalent. We're having higher rates of death in the African American community. So we really have to make sure that that population is specifically tuned in to get those colonoscopies early and make sure we start that screening at 45 and maybe earlier, depending on your family history.
Yeah, I was going to say, you mentioned it's a painless experience. As somebody, I'll be 27 next week, so I'm not that close to 45, obviously, but I'm already dreading the experience. So for somebody like me who's like, oh my gosh, I don't want to do that, kind of ease my nerves a little bit and just kind of express, again, the importance.
No, absolutely. It was like the best what 25 minutes sleep I ever got, right? It is completely painless. You know, you are put to sleep, and by the time you wake up, then you're finding out how everything went, which I'm really grateful that everything went well. You know, you have to do the prep before.
I think that's what's freaking me out a little bit.
But, you know, that can be a process.
Sure.
But it's definitely worth it to get a clean bill of health or find out that there's something that you found really early and that you can take care of so that you can go on to live your best life.
Yeah, it's like 48 hours of misery, if you want to call it, if you want to be
less,
a downer, but
even
it's
less.
not even that, because you're saying it's easy. We're hearing of a measles outbreak in Chicago, Illinois being one of the states that has probably the most cases right now. We talk about it all the time in the news, and you hear measles and you're like, isn't that of like the past? Like, where did measles come from? Kind of talk to me about, and you can talk about it too, Dr. Sterling, if you have any experience with it right now, of just kind of what's going on in Chicago and what people need to look out for, since those numbers are starting to ramp up a bit.
Yeah, I think some of the latest numbers, we have more cases in the first 3 months of the year than we had all of last year.
Right.
So there have been some significant outbreaks, Chicago being the location for one of the major ones. This is a very contagious viral infection that, you know, is almost entirely preventable. In fact, I would say that it was eradicated from the U.S.
Right.
When you have those high vaccination rates, it is, you know, the vaccine is very effective. And so, you know, anyone who is not vaccinated, it's very important that you get vaccinated. But it is a highly contagious disease. It's one of those diseases that if you were exposed to it and you're not vaccinated, there's like a 90% chance that you will get measles. And it's a serious disease. 1 in 5 people can have a very serious complication. So we really want to go back to the days when we called it eradicated. We want to make sure we keep our vaccination rates very, very high. And, you know, if you are told that you were exposed to it, please see your physician to figure out what the next steps are.
Yeah, absolutely.
So there's a certain amount of cause and effect that the people that are watching just really need to appreciate. Number one, it literally was considered eradicated in the United States just a couple of decades ago. Here in Chicago, we actually were one of the highest immunized communities in the entire nation, and thus the rates were fantastic. Well, it's very simple. Those that are not immunized are the ones that are at risk. And if people get on whatever bandwagon tells them that vaccines are not good or immunizations are dangerous themselves, that is where the risk lies. That is where the growth has occurred. That's where the cases are coming from. So to the extent to which people have already been vaccinated and immunized, you're going to be okay. So keep that same energy. Trust that this wouldn't be an epidemic if everyone had continued the same thing that had been going on for the time frame that led to this being eradicated in the United States.
And does that vaccine, you know, we get it typically when we're younger, is that good just forever?
Yeah, typically if you get it on your birthday, you know, maybe not your birthday, but at that 1-year visit, you know, 12 to 15 months, you get that shot, and then you're supposed to get another one after about when you're going into kindergarten. So, you know, about 4 or 5. And so if you get those 2, you are fully immunized.
Forget about it.
Wow, forget about it, exactly. Well, quickly, looking ahead to April now, we have Black Maternal Health Week, we have National Minority Health Month. Just kind of talk to me about what are some of the things that we can expect and look forward to for next month as far as health goes.
You know, well, basically at Sinai Chicago, that's all we do. Like, we are out there trying to make sure that we narrow these disparities. We want to make sure that every person, whatever your color, whatever your creed, that you are getting, you know, safe, respectable, quality, comprehensive care. And so we want that for maternal health, where we're seeing, unfortunately, that the rates of maternal mortality are significantly higher for women of color, worst for African American women. And so we really want to identify, you know, all of the things that we can do to like narrow those gaps, because having a baby, it should be the most joyous time in life, and it shouldn't result in a death. And so we want to do all that we can to avoid that awful outcome.
And really, the number to remember is somewhere 75 to 80%. Those are important numbers in this conversation, because 75 to 80% of the causes of maternal mortality are preventable. I want to go back to what we were saying about literally being empowered to take care of yourself. You can't wait. If you think you may be pregnant, you need to get evaluated, you need to get plugged into the system, you need to get prenatal care. And that same 75 to 80% number is something to remember in terms of the disparities that exist. Black women suffer at a much higher rate than the general population when it comes to these things. So for this particular community, it's just critical that we get plugged into the system and things will be better in terms of lowering your risks.
Yes, and when we have you guys in the community, we can all trust each other here. Thank you so much. You can find more on the work Dr. Sterling is doing at jeffreysterlingmd.com for more information. You can also visit SinaiChicago.org. Thank you guys for coming in.
Thank you.
Thank you.